the Assistant Dean of Academic Affairs at the Norda College of Osteopathic Medicine in Provo. It's so good to have you with us today. And then we have Mackay Bere, who is here. She's also a pre-med undergraduate at the University of Utah. Her major is in health society, and she has a policy minor in pediatric clinical research. Mackay was born in Kenya and raised in Utah, and her career goal is becoming a family medicine doctor. Thank you, ladies, for being with us. I would turn the time over to you guys right away so we can jump into it.
Thank you for that intro. We appreciate it.
Yeah. All right, so we'll go ahead and just start with our presentation. Okay. So, our presentation today is on COVID-19 and travel. There has been an update made with the mask mandate as for April 20th. So just a couple of days ago, I will be providing information with everything you all need to know about the new rules in the US. So what are the new rules for flying with masks in the US? So on January 29th, the CDC order requiring masks on public transportation and conveniences and at transportation hubs is no longer in effect. Therefore, CDC will not enforce the order. CDC continues to recommend that people wear masks in indoor public transportation settings at this time. Most major airlines in the United States have made mask wearing optional following the latest legal ruling, although may be required for some international destinations. TSA stated they will not enforce mask wearing on public transportations or hubs. So we have a small clip here just showing that flight attendants' reactions with the new mandate, and I'm just going to go ahead and play it.
Wear your mask in the blue bag. Roll away your mask. Woo!
It's been 2 years and finally things are finally getting back into order. So that's nice. Okay. All right. So which airlines have made mask optional? So we have Alaska Airline, Allegiant, American, Delta, Frontier, Hawaiian, JetBlue, Southwest, Spirit, Sun Country, United Airlines have all ceased to require face covering. This means both passengers and crew members for these carriers are no longer required to wear them on domestic flights at present. So, do we still need to wear masks for international flights? Destination you're traveling to? United Airlines released a statement on Monday declaring that masks would be required on select international flights, while American Airlines has noted that masks may be necessary from certain international locations based on the country requirements. It is important to check guidelines to where you are traveling so you are not caught off guard, because you may still be required when at international destinations. It's advised to check with airlines before flying. Rules may also be different from airport to airport, so it's good to check those guidelines before you go on for your trip. Also, if you plan on traveling international, it's good to have this information. You'll need to get a COVID-19 viral test no more than 1 day before your travel by air into the United States. You must show your negative results to the airline before you board your flight. If you recently recovered from COVID-19, you may instead travel with documents of recovery from COVID. Will the judge's ruling stand? The short answer is uncertain. The removal of the mandate was an abrupt development after U.S. District Judge Catherine Kimball overturned the mandate. Biden administration officials were caught off guard by this mandate. The CDC said on Wednesday that on ordering requiring masks in the indoor transportations remains necessary for public health. And the agency said he asked the judge's department to proceed with an appeal. CDC will continue to monitor public health conditions to determine whether such an order remains necessary. CDC believes this is a lawful order well within CDC like legal authorities to protect public health. Can you still wear a mask if you want to? The answer is yes. Passengers can still wear a mask on board aircrafts if they would prefer to do so. However, mask wearing is not required under federal law while the ruling is being reviewed. They also said that individuals who are vulnerable to severe outcome from COVID, it is highly recommended that they stay masked. They should take off their mask to eat and drink only when not around others. That could be at an empty gate at the airport. Just because masks aren't required by the government doesn't mean that you shouldn't wear them. Okay.
And I guess this brings us to the should you still wear a mask on public transportation? And I just wanted to point out this data was as of yesterday. So right now we have a total of basically 80 million plus cases with about 58,000 new cases that we're looking at. Every 7 days, the rate per 100,000 people is around 90. So basically quite a lot. And the total number of deaths, when you look at it, we are getting to the point where almost 1 million people would have died of COVID to this point. And that number, I don't think people realize what 1 million people in the United States dying from a disease means, right? And this is over the time frame of less than 2 years. So that's a very, very high death toll. Unfortunately, COVID isn't completely done with us. We are in better shape. In Utah, we're actually in pretty good shape. Our case counts are much lower than the rest of the country. But just please keep in mind that this pandemic is not over. And as we start easing the measures that we've been taking that have been keeping us safe, the case counts are likely to start spiking. And we could very well have new strains as well. And keep in mind that even if you're vaccinated and in good health, which means you're not worried about serious negative outcomes for yourself, you can still transmit and infect others. And there are people who either cannot get vaccinated or have immune conditions or other underlying conditions that makes COVID very dangerous for them. And also children that can't get vaccinated at all. So please, as much as possible, take serious sort of your obligation to public health and your community and family members around you that might require you to still keep being a little bit more careful in order to keep them safe, particularly when doing something like traveling. If it's required for work or certain events, that's fine, but just keep in mind that there's still a pandemic out there. It's not entirely completely over.
If you're medically vulnerable, here's what you should do. According to the medical analysis, Dr. Leanne, a high quality mask such as N95 remains a hugely important tool when it comes to reducing the risk of infections, particularly while indoor public spaces. So avoid places that are poorly ventilated. It is said that for individuals who are vulnerable to severe outcome from COVID are highly recommended to stay masked. What is the risk of catching COVID while flying? The International Air Transport Association has previously stated that the risk of contracting COVID on board of flight is very low, even when factoring a Omicron variant, which appears to be more transmissible than other variants in all environments. Lindsay Marr, who is a tech, stated that there is a smaller chance that someone who is infected will be on the plane. And we know that planes have excellent ventilations and filtrations, which help reduce the risk of transmission on a plane. And Dr. Sanjay Gupta have said that because of the rapid air exchanges, most airplanes are safe environments, but the real risk of air travel is when passing through the terminals and other enclosed spaces.
And one thing I want to add to that is just keep in mind that those HEPA filters, the really powerful filters that the airplane has, they're on as long as the aircraft engines are on. So I would say that while you're flying, you're fairly safe. However, until those aircraft engines are actually turned on, so if you're on the tarmac and you're not actually moving yet, then you don't quite have circulation yet. So it's a very important caveat.
So what if there is a sick passenger on your flight? According to the CDC protocols, if a sick traveler has contagious disease that is a risk to others on board the airplane, CDC works well with local and state health departments and international public health agencies contact exposed passengers and crew. Be sure to give the airline your current contact information when booking your ticket so you can be notified if you are exposed to a sick traveler on a flight. So these are some questions that you should consider when traveling. Have you been vaccinated against COVID-19? If you haven't, you should get vaccinated. If the vaccine requires 2 doses, wait 2 weeks after getting your second vaccine dose to travel. If the vaccine requires 1 dose, wait 2 weeks after getting the vaccine to travel. It takes time for your body to build protection after any vaccinations. Have you had any booster doses? Having all recommended COVID vaccine doses, including boosters, increase your protection from serious illnesses. Are you at increased risk for severe illness? Anyone can get COVID, but older adults and people of any age with certain medical conditions are increased risk for severe illness from COVID. Do you live with someone who's at increased risk for severe illness? If you get infected while traveling, you can spread COVID to the people you live with. When you return, even if you don't have symptoms, does your home or destination have requirements or restrictions for travelers? Even if you've had all recommended vaccine doses, you must follow state and federal testing travel rules. So it's important to check local requirements and restrictions and situations. Some state, local, and territorial governments have requirements such as requiring people to wear masks, get tested, be vaccinated, or stay isolated for a period of time after travel. Before you go, check for requirements at your destination and anywhere you might stop along the way. Keep in mind, these can change often and quickly depending on local conditions. It's also important to understand that COVID situations such as the level of spread and percent of variants varies in each country. So check back for updates as your trip gets closer.
Yeah, I think that's one of the things I want to sort of reiterate because the requirements change constantly. And so it's not enough that maybe you check the requirements at the time you book your ticket. You have to check the requirements before you travel. And even while you're traveling, you could actually have requirements change on you midway. And so by the time you're returning, there are different requirements than at the time that you left. And so just keep in mind the dynamic situation that we are in regarding COVID-19. Hopefully this is on its downward trend and we don't have another strain and we won't have another spike at the very least, at least until the fall.
So for vaccinated people, if you have been fully vaccinated, the CDC states that you don't need to get tested before or after your trip within the US, or stay home after you return. If you're planning to travel internationally outside the US, the CDC states you don't need to get tested before your trip unless it's required at your destination. Before arriving to the US, you need a negative test within the last day before your arrival or a record of recovery from COVID in the last 3 months. After you arrive in the US, the CDC recommends getting tested with a viral test 3 to 5 days after your trip. If you're traveling to the US and you aren't a citizen, you need to be fully vaccinated and have proof of vaccination. Oh, you're muted.
So there's a question that was asking about what happens if your COVID test is expired when you enter the United States. And the reality is that the CDC itself doesn't test, there isn't a checkpoint where someone is checking your COVID test when you're walking into the United States, not even at the border, right? The way that this actually works is that if you don't have a valid negative test, you won't be allowed on the plane. So even before you board your plane to the United States, you have to have a valid test. And if you do not, they will refuse you getting on that airline. Most of the time, what tends to happen is airports around the world have COVID testing places, either close to the airport or within the airport, that are able to do rapid antigen tests fairly quickly. And so if you are at the airport, several hours before your flight, you're most likely going to be able to go ahead, get tested, have a negative test result, and then get on the plane. However, obviously, if you do get that test and your test results are positive, you're not going to be allowed to board that plane until you eventually have a negative COVID test, which might take a while for your test to eventually become negative. And that has happened to a fair number of people with traveling during this COVID pandemic. And so one of the things to keep in mind when you do travel is that you not only have to be careful about, not contracting COVID while you're traveling, while you're away, you have to keep being very vigilant, because if you do contract COVID and then you don't test negative, the day of traveling back, you won't be able to get on that flight to come back to the United States. That's for international travel specifically. Domestic travel is a little bit easier because most of the time I've never heard of a situation where anyone's actually checking that you are getting tested. It's just a recommendation. And then depending on your job requirements, you might be required to actually show proof of negative tests and things like that.
So for unvaccinated people, testing before and after travel can lower the risk of spreading the virus that causes COVID. If you haven't been vaccinated, the CDC recommends getting a viral test within 3 days before your trip. Delay travel if you're waiting for a test result. Keep a copy of your results with you when you travel. Repeat the test 3 to 5 days after your trip. Stay home for 5 days after travel. If at any point you test positive for COVID, stay home. Stay home and away from others if you develop symptoms. And most important, follow public health recommendations. So the hotel industry knows that travelers are concerned about COVID and safety. Check any major hotel website for information about how it's protecting guests and staffs. Some things to keep in mind is how they enhance cleaning procedures, physical distancing, recommendations indoors for people who aren't vaccinated, mask wearing and regular hand washing by staff, mask wearing indoors for guests in public places and areas that have high cases of COVID, vaccine recommendations for staff, isolation and testing guidelines for staff who've been exposed to COVID, and contactless payment. So it's important to consider the people that have increased for risk for COVID. Anyone can get very ill from the virus that causes COVID, But older adults and people of any age with certain medical conditions are at increased risk for severe illnesses. Travel increases your chance of getting and spreading COVID. If you are vaccinated, staying home is the best way to protect yourself and others from COVID. If you must travel and aren't vaccinated, talk with your healthcare provider and ask about any additional precautions you may need to take. Overall, it's important to stay safe. Even the most detailed and organized plans may need to be set aside when someone gets ill. Stay home if you or any of your traveler companions have signs or symptoms, are sick or think they have COVID, are waiting for a result of COVID test, have been diagnosed with COVID, have had close contact with someone with COVID in the past 5 days, and you are not up to date with your COVID vaccine. If you had close contact with someone with COVID, get tested after at least 5 days. Wait to travel until you have a negative test. Wear a mask if you travel up to 10 days after you've had close contact with someone with COVID. Thank you.
And we had a question that came in through the chat that was asking about what's the recommendation if you are fully tested and it's negative, but you have symptoms like coughing. Keep in mind that there are a lot of things that cause cough that have nothing to do with COVID. And so if you are tested and you are negative, that basically means, depending on the type of testing that you've done, that you don't have detectable levels of the virus in most of the time your nasal pharynx, which means that you wouldn't be infecting anyone. Now, obviously, there's also chances that you are actually positive for COVID, and it's just a false negative test result. However, those are extremely rare in cases of PCR tests. They're a little bit higher likelihood if it was just a rapid antigen test. And so you might want to maybe repeat the test to see if it still stays negative. But if it still stays negative, then you probably just have a cough or have a flu or have a cold or have any one of the other major causes of cough and not necessarily COVID. So cough in and of itself isn't a telltale sign. And actually cough in and of itself isn't actually very typical of COVID. So a lot of people who have COVID don't necessarily always have coughs. So what happens if you test negative but actually have COVID when you get tested again after traveling? So that becomes the issue, right? And that can happen because what happens is either the first negative was a false negative, or you just hadn't built up enough concentration of the virus within the nasopharynx for it to be detected. And then eventually, once it became detectable, you then had a positive test result. You are more likely to be able to infect other people if you're testing positive. If you are not testing positive, then even if you do have some, infinitesimal amount, you're likely not shedding much, especially if you're vaccinated. So vaccinated patients, even if they are infected with COVID, oftentimes they just have no symptoms whatsoever. And yes, even when they do test positive, the amount of viral shedding, the amount of virus that they are actually able to sort of spew into the atmosphere around them to infect other people is much less, which is why if you have a community of highly vaccinated people, the transmission of COVID is much less than, if you have a lot of people around that are not vaccinated. Can you be fully vaccinated and still infected with COVID? So keep in mind that what the vaccination does, it trains your body how to fight the infection, right? So vaccination doesn't prevent you from getting infected. What vaccination does is it prevents you from getting very sick, because basically you've already trained your body on how to fight the COVID infection. So what that means is you will not end up with as severe of a disease as you otherwise would have, and you're not likely to be, if you're having milder disease, you're going to be spewing less virus into the atmosphere around you. So yes, you could still, if you are vaccinated, test positive for COVID, you can still get infected, you can still get sick, but you're going to be protected against severe disease. You're going to be protected against hospitalization and poor outcomes. And you're also going to be less likely to infect the people around you because you are vaccinated.